So what is the venous blood pressure? Yes, the venous blood pressure is the pressure of the blood in the veins. This is not routinely measured. Yes, we usually think about arterial blood pressure. Yes, systolic and diastolic arterial blood pressure. The venous blood pressure is far lower. Yes, the value is about 5.8. Is quite normal. Why do you would want to measure the venous blood pressure, and when it is done? It is usually made in case of the severe ill patients in the intensive care unit, in the ICU, as the venous blood pressure tells us whether there is enough or too much of the fluid in the patient. So when the venous blood pressure drops, it means that there is not enough fluid in the body. When it rises, it means that we have too much fluid in the body. So it's very good in measuring this thing. It will also, there is not the only thing. Yes, we can have also a lot of things that may inhibit the flow of the vein through the veins. Yes, for example, some tumor that will push on some tissues. It will squeeze the veins primarily and the capillaries to some, of course. Because the arteries are hard and have high pressure in them, they are usually not squeezed, so the blood flows. But in order for the blood to return, they need to get through the veins, and it may be harder in a lot of cases. So this will increase the venous pressure, and they may become visible on the body to some extent. Also, what will make the blood flow through the veins more efficient is muscle pump. So when we have the muscle, the vein is getting through it. Yes, and every time we squeeze the muscle, we squeeze also the vein. Why it's important and why it is effective? It is effective because the veins have the valves. So although in normal hose, yes, water hose, if you would squeeze the hose, the water would get into directions, yes. So, in both directions. When we have the valves, it would go only in one direction. So simple squeezing would be effective way to get the blood flow more effectively through the veins. Also, why it is important? It is also important from the perspective of the heart. As the heart gets the blood from the veins, and in order to pump a lot of blood out, you need to get the same amount in. So if the venous return, so the amount of blood that flows through the veins into the blood would not be big enough, so the blood flow through the veins would not be fast enough, the heart wouldn't have anything to pump. So this is critical to get the proper blood flow through the body. Thank you.